Hello guys, my name is David Oguche. I'm a final year medical student, and in this video I'll be sharing with you step by step how you can pass your O&G exam in one sitting. The O&G posting is an 8-week posting, and in the posting you'll be moving from one unit to another in an 8-week period, and at the end of the posting you'll be required to write an OSCE test. So there's what they do in O&G department, that you write a book of cases, one for obstetrics and the other one for gynecology. So you present a case to you are going to type it. Depending on your supervisor, you may say you should submit via email or printed. So take your book of cases serious. It's going to be marked, and the marks will be in your final cumulative. So the test is usually best of 5, and then or best of 4 rather, because their own is just 4 options. So you try as much as possible to pass all your tests and focus on the end of posting test, which is OSCE. So the OSCE test at the end of the posting is going to be like the stimulated patient. They'll bring patients that you clerk. You'll be moving from one station to another. I have to be checking because I wrote some things down to be checking and telling you. So you have to be moving from one patient to another, one spot to another, just like you did in your anatomy steeplechase. So that's how the OSCE goes. So what textbook will I recommend? So I will recommend 10 teachers, which I actually read both the O and the obstetric part and the gynae part. So during my time I read them and jotted down like everything in the textbook. So if you cannot do that, then just read major points, major topics. And also I will recommend Principle of O&G. That book, I read it back to back several times. So it gives a summary of the O&G, what to expect in O&G. And one thing I'll let you know is O&G are very nice people, so you can always relate with them and they are always willing to teach you. Then so practice examination with your pillow, like obstetric examination, how to examine the gravid uterus, general physical examination, abdominal examination. All those things are things you'll be seeing in your OSCE exam, so you have to use your pillow to be practicing. And then learn focus clerking. During my time, what I did was to prepare a list of topics, like things that they can say, okay, clerk, take a focus antenatal care. So I wrote down how to do it step by step, and for several other focus clerking, and I memorized it. And I timed myself that I can be able to finish it in less than 2 minutes. You get, so you can time yourself, focus clerking, examination, all these things, time yourself. You can do it in your room and recite like that. There are a lot of instruments that you need to also know. So another thing you need to do for the O&G posting is to ask for mock tests in the unit that you are. So some units arrange mock tests for their students, and then these students tend to do well more than other students in the general test. So just try and ask for a mock test. And then so another thing is to be calm when things are not going well. For example, in the exam, like in the OSCE, there are some stations that you not do well. So there are several stations. So once you don't do well in a particular station, don't like panic, just calm down and move to the next one, and try as much as possible to get maximum score in the next one. And then make sure you go around for the posting. Their logbook has marks, so you wouldn't want to like not get the marks for the logbooks. So the logbook is not only used for eligibility, but also for marks in the cumulative. So make sure you fill your logbook very well. Make sure you go around so that you can fill your logbook back to back, and then that will help you to get a lot of scores when they add it up. Then the final tip is like prayer. This O&G senior posting is just prayer, like God. So just take God seriously, and I know he will guide you through. All the best. This is the end of the video, and I believe you'll do well. Please like, share, subscribe, and comment. Thank you.